I think that is everything before we get started. So without further ado, I would like to introduce tonight's guest, Carly. Carly, thank you so much for joining us tonight. Really exciting to have you.
Thanks for having me, Cassie.
So I think probably the easiest thing to get started is if you would like to introduce yourself and just give us a little bit about your breast cancer story.
Okay, so my name is Carly, and I was diagnosed with triple negative breast cancer when I was 37 years old. It was December 2019, the day before my little girl's 4th birthday. So a day that you kind of never forget. And I had just previously, maybe like a month or so earlier, been hanging out of a window with about 50 other women wearing pink bras, raising awareness for breast cancer, because my own mum had died from breast cancer 10 years earlier. So breast cancer was kind of a big part of my life already before my diagnosis. I had a lot of treatment, 16 rounds of chemotherapy alongside immunotherapy, a double mastectomy, reconstruction with my tummy tissue, followed by radiotherapy and back on the immunotherapy. And in February, it was 3 years since I finished all treatment. So quite a massive milestone. I have shared loads since diagnosis because I was already kind of raising awareness of breast cancer. It was, it felt quite, obvious or natural for me to just keep sharing. And I'm really grateful I did, because it connected me with a really incredible community of people and support. And through sharing and through kind of continual work in the community, I now work as an ambassador for a breast cancer app, a supportive app called OWISE, which is a free app, an amazing app. And I'm also the patient champion for a new medical device called Bloom 43 that is in development. Hopefully will be able to be used by patients soon, which is helping anyone that's going in for mastectomy surgery to prepare. There's a lot of science behind it, which we can go into. But yeah, so I do both those things. And I also have almost finished training as an end-of-life doula. So keeping busy, but very much wanting to show up, talk about breast cancer, have conversations like this, and give people that hope and share my story, because I know that's just what I wanted so much back in December 2019, to see others.
Absolutely. And I think there's so many elements of your journey and your story that will resonate with people and people really relate to. So there's lots of different areas that we can cover tonight. Maybe if we start with the BRCA gene alteration. So you were diagnosed with your breast cancer first and then found about the gene alteration afterwards, or was it the other way around? Did you know from your mum's diagnosis?
No, so there's a really weird what is it called? A twist of fate in the story. My mum did not have the BRCA gene alteration. Her mum also had breast cancer and died from breast cancer. So I actually did go to try and get tested for BRCA 3 years before my diagnosis. And at that time, the breast clinic I went to kind of mapped out my family tree and asked me lots of questions and said, you don't actually qualify for BRCA testing. So I walked away thinking, okay, tick that box. At least I went and I talked to them and thought I guess I thought I was safe from it. Fast forward a few years, my older sister was diagnosed with late-stage ovarian cancer, stage 4B. And my older sister is a half-sister on my dad's side of the family. My dad is of Ashkenazi Jewish heritage. She found out she carried the BRCA1 gene alteration. And even before my diagnosis, so I was diagnosed in December, she called me in August to tell me she carried it. I was on holiday. And I do remember kind of having a really big cry, just because I think it was that thought, oh my goodness, this is in our family. There's a chance I've got it. What does that mean? I wasn't sure I'd done with having children. I had 2 children at the time. So even at that point, before even being diagnosed, it carried a lot of weight, BRCA. But I knew I wanted to get tested. My kids at the time were 3 and just turned 6. So that was in my head, but I was in Spain, and it kind of, you get back, they go back to school, all of this stuff is going on. Life is really busy. So actually, by the time I found my swelling under my armpit, I was on a chemo ward with my sister, who was going back to start her back on chemotherapy after she'd had a big operation. And I felt this really big swelling under my armpit. I hadn't got round to testing, but I basically was diagnosed with breast cancer before I'd got round. And so, yes, I did find out I carried the BRCA gene alteration after my diagnosis. But the day I was diagnosed, I did think, well, I must have it too. I mean, what are the chances?
Yeah.
But yeah, then the testing takes a while. I think I actually found out, I got the phone call about carrying the gene alteration whilst I was in chemo. Yeah. And I've said it before, it was the biggest grief imaginable at that point in time for me, I think, for many reasons. But ultimately, I just thought of my kids and thought, oh my God, I might have given it to them.
And that's something that we hear quite commonly from people, is actually that sort of diagnosis. Actually, you're not necessarily even thinking about yourself, you're thinking about your family and the implications for them, because it is there's such a wider situation there, and that's going to be different for everybody. But yeah, it sounds like there was a lot leading up to it as well. It must have been an incredibly difficult time.
Yeah, I mean, nothing can prepare you to get diagnosed. And I think when I found my swelling under my armpit, it was painful. Even though I was so fully aware of signs and symptoms, and I'd done so much awareness around getting people to check, and I did check, and I was kind of quite aware of my shape and what to look for. And my mum, when she first found hers, I'll never forget, she showed me like the puckering. She kind of bent down and it puckered. Told me about that. So I felt really like I was knowledgeable on breast cancer. But I was like, oh, pain? A painful swelling? That's not going to be breast cancer. That's going to be fine. There was no lump to fill in my breast. So I convinced myself it wasn't. Went out for dinner with girlfriends the day I had my biopsy, and they were like, we're going to, gave me an MRI. All suddenly went very serious as they scanned the left side for so much longer than the right. But I went out for dinner with girlfriends, didn't tell them any of it had happened, all bandaged up, because I was like, well, it's not going to be anything, so I don't want to worry them. So I think getting diagnosed really did shock me. And I also really thought, there's no way I'll have it. My sister's going through chemo. What are the chances? So all this stuff is going on. But actually, when I did start my chemo, the nurses said, we hear this a lot. We hear of like sisters being diagnosed at the same time, mothers and daughters. So you just don't realise at the time. You think, what are the chances? No way. And maybe that was a coping mechanism as well, to try and
I was just going to say, I think for some people that's sort of a bit of a mental protection, isn't it? A way to sort of cope with the uncertainty of
because when I actually got the diagnosis, it was only then that my best friend and my husband said, well, we've been really worried. I'd been sleeping okay. I'd been like really, I'd almost put it really, truly. So, but it was there was a lot going on. Because it was, triple negative, which at the time, again, I thought I knew so much about breast cancer. I didn't know about stages, and I knew about stages, but I didn't know about grading. I did not know there was so many different types. I didn't know that the chemo I was going to get was going to be different to what my mum had. So suddenly you are thrown into a world where there's so much new information to take on board. Then I wasn't rushed into chemo, it wasn't urgent. I was stage 2, grade 3. So it was quite near to Christmas. And I remember speaking to my oncologist and saying, please, can we just get through Christmas? Can I start chemo after Christmas? And he said, a few weeks won't make a difference. So it wasn't like it was mad rush to get started. However, it was very much like, this is an aggressive type you've got. We need to treat it aggressively. You're going to be having chemotherapy first. So much going on, so much to process. And then you're just rushed onto the chemo train. And so when I got the call about BRCA, I was kind of in this, just on this kind of hamster wheel type thing, just going from week to week, because it started with the weeklies. So it was, thinking back, it was a really crazy time. Really.
And that sounds, you paint a sort of really, really vivid picture there, because a lot of people talk about sort of that point from diagnosis to starting chemotherapy, and how you end up kind of just rolling with it because there are so many appointments and so much in terms of logistics that your mind doesn't have that opportunity to really think about what you're going through at that point. You just kind of get swept along with it, and then throw in something like the BRCA gene diagnosis sort of during that kind of breaks that up a little bit. I can imagine that came as quite a shock at that point. And was there anything that you found particularly helpful at that point? Any support that you accessed, or did you just kind of focus on those logistics?
I'll be honest, my sister had such an amazing response to chemotherapy, and she had been on exactly what I was on, which was carboplatin and paclitaxel.
Okay.
They started me, she was stage 4B as well, and by the time it came to her operation, it had all but melted away. So they started me on carboplatin and paclitaxel because I was given pembrolizumab as well, and the studies that they had done in early stage breast cancer where they had given pembrolizumab, they'd done it this way around. So AC came after carboplatin and paclitaxel. So there was this weird moment where I found out I had BRCA, and I was like, okay, well, my sister's responded, so that's a good thing. So there was also this thing of like, I'm going to respond potentially really well to the chemo. So it was such a mixed time because it was so much grief, but then there was also like, no, this is going to be okay as well, because I'm actually I think I'm going to beat cancer. Like, this is good. So that was a help to me, just having that knowledge that I carried the same thing as my sister. We were having the same treatment. And I just, in my head, said, then, yeah, I'm going to have a good response too. I think you just try and clutch at anything to keep yourself mentally strong. I didn't get a lot of support around BRCA, though. I will say that I think when you find out you carry BRCA and you're already in the cancer pathway, the focus is very much on treating the cancer.
Yeah.
I now run co-host a support group for people with BRCA and BRCA plus. So we have some people coming with different gene alterations as well, and we speak a lot at that group about kind of people come that are going in for preventative surgery. So there's a lot of talk on the differences, I guess, in that way, and what the main difference is, that kind of time to process, that you have to be fit psychologically to go in and have your preventative surgeries, that you kind of have, there seems to be quite a lot of support, whereas I don't think I found that, and not in a bad way, but just in a, we just need to treat you. We're more concerned about what you're feeling from the chemo.
The focus was on the cancer that you had.
Yeah, exactly. So it did go a bit to the side, and that's fine. I had my big cry, and then it was like, right, focus on just getting better, because I eventually just had a pep talk with myself. My kids were 4 and 6. It was like, hopefully, by the time they can even be tested for this gene, maybe there's going to be some amazing science or medicine or something that will just be able to do something really good.
Yeah.
So that was how I have got through it, and it's still how I get through it. You know, they're 10 and 8 now. I haven't talked to them yet about the fact that my cancer came from a gene alteration. This is conversation that is going to happen potentially, but it's ongoing, and
again, it's such a personal thing, isn't it, for different families as to what's going to be right for them in terms of what information is shared and when. And it's one of those situations where there is absolutely no right or wrong. It's about doing what's right for your family at that moment in time. And it's obviously a very difficult conversation to have. And there's some fantastic sort of charities out there that do some support with talking to children, not only about sort of gene alterations, but with going through cancer. And there's one charity in particular called the Fruit Fly Collective, who are doing some work. They do a lot of work around talking to children about cancer, but they're starting to do some work around talking to children about gene alterations and cancer risks. So in the future, there may well be even more support available, which would be fantastic.
Oh, I'll look at that. Before my diagnosis, I worked for a charity called Grief Encounter, which provides support for bereaved children. It's a really incredible charity. And so before I spoke to my children about my diagnosis, I actually reached out to someone I knew there and was just like, please help me. Like, how do I do this? What do I say? Even though my diagnosis was being given to me as a relatively good one, and there was lots of talk of it being very treatable, and the aim was to cure me and everything like that. I was just like, it's just such a big conversation to have with such little people, and that was really, really helpful. They really gave some useful advice, which I always try and share with others as well, which is
fantastic.
It seems kind of obvious, but it's that thing of talking to them age appropriately, not saying anything that you can't fully back up. So I was really careful with my wording. I never ever said I'm 100% going to be okay, because I didn't know. How did I know that? So I said I'm going to have some really strong medicine that is hopefully going to fix these cells. And I actually remember another friend of mine, not the therapist I spoke to, she told me about explaining it as Lego that's not slotting together well, so they could have like a visual idea. And so I remember saying to them, my cell, we all have cells and they all work really nicely together, a bit like Lego. It just slots together nicely, but I've got some bad cells in this area and they're just not slotting together like Lego should. So I'm going to have some really strong medicine, some superpower medicine, but it might make me lose my hair and, all of this stuff. And and also the biggest tip with children that she said was they're really likely to kind of just go, okay, maybe ask one question and then want to get on with their day. But it doesn't mean that you close that door. You don't just not talk to them again about it. Keep that conversation open. And it's like I talked about the BRCA. I'm really open with my kids in terms of breast cancer. They know, they've known all along, like how I'm feeling, and they know I do a lot in the community. And so they're fully knowledgeable and open chats. And we've always talked about their worries and their fears and things as they've come about. And they have changed with time, because at 4 and 6, they didn't know about cancer. And then now they're kind of 10, 8, they do. They know the word, they know people can die from cancer. So the conversation has changed. But I'm also, I feel lucky, very lucky to be well and to be able to talk to them from a well place now too. So,
Wow, that must have been incredibly difficult at the time. And I know it's something that comes up a lot through our younger women's support network is, like you say, around sort of making sure to talk to children in a way that's very open and honest, but appropriate for their age and their personality. And as we're saying, there is support out there to help with that through lots of different avenues if people need it.
And the recommendation to talk to them earlier in the day when they're not overtired. That was, I do remember that.
That's a really good practical tip.
Yeah, it's like little things like that, because it just was the most daunting conversation ever. And I was so relieved once we had it, because actually they really pick up on stuff, children. And, at this point, family members had come over at funny times. Suddenly it's a lot of hushed conversations, a lot of looks going on. And it's just, from our point of view and for our family, it worked just having open, honest chats. And
I think, again, as we've said before, I think that's a good point, isn't it, that everyone's families and everyone's family dynamics are different, and people know their kids, and it's about sort of finding the thing that's right for you in that moment.
Totally.
Amazing. Carly, I know we wanted to talk a little bit about your surgery as well, if that is okay. So you made the choice to have bilateral mastectomy and breast reconstruction. And I just wonder, obviously it's quite a big operation to go through, particularly again with young children. How was that experience for you, and how's the decision making? Because we hear from a lot of people through our helpline and through our Ask a Nurse service talking about sort of the difficulties of making that kind of decision.
I totally feel for those people, because I really, really struggled. I struggled to make any kind of decision. It was like, so in terms of my surgery, what was said was at diagnosis, you've got, you're looking at 6 months of chemotherapy, followed by a radical surgery, followed by perhaps some more radiotherapy. You're looking at about 9 months of treatment. That was how it was packaged to me. But all I could hear was chemotherapy. So at that point, it was like, get through that. Once I was through that, and kind of towards the end of chemotherapy, it was started, the talk of the surgery started to come about, and it was like meetings to meet with my breast surgeon, and then meetings to meet with a plastic surgeon. And so suddenly you're like nearing the end of the chemo train, and it's like full steam ahead on the surgery one. So at that point, I was so unwell. I'd really struggled with low bloods. I've totally forgotten what that's called now. Begins with N.
Oh, neutropenia.
Neutropenia,
So
yes.
that's, for people that don't know, that's low white blood cells.
Yes.
So it makes you more prone to infections.
So I was like at 0.1 with that, even with the injections. I had to go into hospital with neutropenic sepsis. I had to have a blood transfusion when I was in hospital, and that was all before my final chemo. So I was really like, when people say like, you crawl, you crawl to the end, one day at a time, one step at a time, you will get there. I definitely did. And, I rang that bell, and I was so glad to have had that last chemo, but I was really physically not in a good place. I also had low thyroid from the immunotherapy I'd been given. I had an underactive thyroid now, so they hadn't quite balanced that out too. So all in all, I was a bit of a physical mess, let's say.
Fatigue as well is quite common sort of after chemotherapy, the exhaustion
but I had
of what you've been
even
through.
more because of the thyroid. I was like literally wading through mud, like trying to. My iron levels were low. My red blood cells were low. My white blood cells were low. So it's done its job. The chemo, it's blasted that cancer away. But you're left. You are left sometimes. Not everyone. I should add as well. This is just what I experienced.
Yeah, of course.
But so I'm starting to have these meetings about surgery, thinking I can't even think. I can't think straight. I don't know what I want. Talking of implants. Talking of tummy tissue, do I have enough tummy tissue? Is my blood vessel in the right place for it? Like all this stuff is going ahead. But something in me, even though both surgeries, I should add, I felt straight away that I did want reconstruction, and I was lucky. It was during lockdown, but I was still able to have immediate reconstruction, and there was a lot of question marks about if that would be possible or not. But thankfully, it was able to happen. It was August time when things started to open up a bit. So the conversation was a reconstruction one, because that was what I felt I wanted. But whether I wanted implants or not, or the tummy reconstruction, was a really big decision that I almost felt selfish making, because my instinct was I really wanted to do tummy tissue, but everyone was presenting it as a much bigger operation. I'd be in hospital for longer. The healing would be longer and all of this stuff. But in my heart, something about it was just like, that felt right to me. I think because my bloods were so low, I was really, really terrified of rejecting a foreign object like an implant. So eventually I did make that decision. I don't know. I don't really know how, but I think just because of the intuitive feel about it. Went in for that surgery, was told I would be in hospital for a week, and that the surgery would be around 10 hours, maybe more. The only surgery I'd ever had was to have my ears pinned back when I was a lot younger. So I hadn't had an anaesthetic for ages. I was so terrified. Also, when it came to decisions, I was given the decision. I was given the decision whether I wanted to keep my nipples or not.
Yeah.
Now, that sounds like you can make that decision. I couldn't. I was like, how do I make such? Everything felt so big, so overwhelming, so much information being told to me, whilst being foggy-headed, fatigued. So I often describe it as when I had my first child and I didn't take the breast pump out of the packaging. And so when I'd had him and I went to take it out, I was like, what is this contraption? I just put it to the side because my brain could not compute any of it. And actually, it was my plastic surgeon. I spoke to him and I said, I can't decide about the nipples. He's like, I know it's only 1 or 2%. Do I keep them? I'd been told they wouldn't have sensation anyway. So it felt like maybe I just do get rid of as much breast tissue as possible because I'm having that surgery. And he actually said, I'll do a better job with the DEP if we remove the nipples. So I was like, okay, you've made that decision for me. And I'm really happy I went with that decision, because I think if you are having a double mastectomy to prevent any risk of breast cancer coming back, then I'm glad I did remove as much breast tissue as possible now that I've got a clearer head. But at the time,
and just say, obviously, for some people it's not an option, it's not a choice, because
because
if it's
depending on where
related
your
to the
cancer is.
exactly, some people will need to lose their nipple because of where the cancer is, but actually when we're talking about the risk reducing side of things because of the BRCA alteration, there are a lot of choices, and that can sometimes be really difficult because a lot of people say, I just want to be told what's the right thing to do, what I should do, and actually in that situation, if all options are equally viable and available for you, you are then left as the patient to make that decision that feels right for you. And I think it was really interesting that you say that at the end of the day you weighed up sort of pros and cons, and there was that bit of intuition that was sort of leading you to go, no, this is in my heart of hearts what I feel is right for me. And actually through sort of counselling patients through these sort of decisions before, I think that is the case for quite a lot of people, that actually you can spend a lot of time thinking over sort of pros and cons.
There is to both of
Really
them, and
difficult.
both surgeries are really incredible. You know, if you want reconstruction, both I've seen amazing results. We do show and tells at Future Dreams now, and I model my tummy tits for others because I know just how much that would have meant to me seeing real kind of breasts post this type of surgery. And obviously it was lockdown, so I didn't have that opportunity. But yeah, for me, firstly, I call them my tummy tits, and I really have learnt to fall in love with them. They're very different to my pre-cancer breasts, but it's been a process, and there is always a grief when your body changes. But I have learnt to absolutely love them. I think my surgeons did an incredible job. I've also had nipple reconstruction, so I've got like the nipple nubs, as you call them. So my hope is that I can be a grandma on the beach with erect nipples in bikinis. That's the dream. That's the hope. But yeah, one of the things that really swayed it for me as well was talking to my plastic surgeon. He said, what's a really important thing for you? And I said, well, my kids love hugging, into my bosom, let's say. And I was like, and it's soft. They feel it's soft. And he said, so I think you've just reminded me of that. And he was like, I think that has made your decision for you then, because tummy tissue is softer than obviously an implant. Although I think there's some really implants that have come so far, and there's some really nice soft ones there too now. But yeah, it is that. It's just each individual kind of knowing what's right.
And of course, some people choose that they don't want reconstruction.
Exactly.
As well, that's a choice for some people, and everyone's so individual.
What I would say about the DIEP, for anyone watching that might be thinking about having it is definitely a big operation, but once you get over those kind of first, I would say maybe the first week, you really I started to see so much improvement quite quickly, but the first few days are really difficult, and there is no sugarcoating that, and I think it's okay to say that you are having a hip-to-hip incision on your stomach. You feel very, very tight because they're removing the tummy tissue to then replace the breast. And really, it was that tummy thing that was the thing that was more difficult to kind of heal from, I would say, than the mastectomy and the lymph node removal that I had. So. Yeah.
Absolutely. And I think actually it's really helpful for people to know that kind of realistic side of it, that actually be prepared that first, good few weeks is going to feel really difficult, but it does get easier.
2 weeks. 2 weeks, yes, but I just remember leaving hospital being like, oh, I can walk up and down stairs now a bit easier. So but it is, like you say, it's few weeks. 4 weeks, I was in very little heels. 6 weeks, you're feeling,
It's that listening to your body, isn't it? Kind of taking things at your pace. And
with DIEP, you can't ignore your body. The days I did do a bit too much, I was like this again. I couldn't stand up straight, so I knew I had to just have a really chill day the next day. So it actually is a lesson in really listening to your body, and you can't ignore it.
And it's amazing hearing you talk about sort of the work you do in supporting people going through breast reconstruction, because I think for a lot of people, as you say, talking to somebody who's been there and been through that kind of experience can make such a difference, just even to get those little practical tips of this is what I found difficult, and this is what I found helpful. So obviously through us there's things like the Someone Like Me service where you can talk to somebody who's had different kinds of reconstructions to help with that decision making or to chat about recovery, but also things like you run with the support group and having that opportunity to talk through with somebody that's been there and had that pathway. I think that can make such a difference for people.
I mean, for me, it was life-changing. Like I said, nothing was open when I went in for my surgery in terms of it being 2020 and lockdown and stuff. But I still did speak to one woman on the phone, one lovely, a mutual friend's friend, and just that was enough to hear that she'd had it with young kids, and hear her saying, you know, it's a tough few weeks, but then it's every day you're improving, and I'm really happy with them and all that stuff. So the power of these show and tells, when we do them, there's nothing like it. Seeing people really scared, arriving really nervous, really kind of with big questions about what they're going to face, and then, you know, they're quite joyful events. All the models are really, you know, you're there, you start a little bit like, okay, so this is me, and by the end of it, you just don't even have your dressing gown on. You're like, everyone come in, talk to me about these breasts of mine. And they are really, really incredible. I would urge anyone that's thinking about breast surgery, I think that various places up and down the country do hold them, so to look into if anywhere near you does have an event like that. Yeah.
And actually amazing for the people needing that at the beginning of their journey, but actually sounds like quite part of their sort of healing recovery process for yourself and people on that side, being able to give that back to people. Absolutely. Do you feel like that has helped you sort of process your own breast cancer journey?
I leave those events, and each one I think I've done about maybe 3 or 4 now modelled in them. Each time I leave so empowered, and also just a bit more kind of like, oh my God, we're doing well. Like talking to my tummy tissue, I'm like, we're doing well. You know, I've been jumping around, showing people how they bounce nicely, and they've become such a part of me. I think we've skydived together, and I leave every time a bit more healed in terms of my body. Yeah. You know, body self-love journey, whatever you want to call it.
And I think it's amazing for people who might be struggling with that sort of body image change to hear that you know, if there's people sort of sitting there thinking, well, I don't feel that way about my reconstruction, or I am struggling with the body image changes, to know that actually you can come to love your new body, whatever kind of sort of shape or form it's taken, I think could be really, really empowering for people to hear.
Yeah.
So really amazing.
My healing started by just thanking my body. Honestly, it sounds simple, but every day, because I have not had the best relationship with my body in life. Very unwell with body stuff in my teenage years, and actually getting breast cancer has been a really cathartic healing experience in terms of that, because I just saw how hard it was working for me. And I really, you know, I really wanted to live. I'm really grateful I am here, getting to live, getting to experience this, you know, one precious life. And my body's doing that for me. So it changed my relationship with it. It really did. So, you know, I could sit and tear it apart. I really could. I could tell you all the things that are flawed about it, how radiotherapy has made one nub a bit smaller than the other. They're not perfect, but they've kept me here, and that's where it started with thank you. Just thank you, body.
That's an absolutely amazing approach. Thank you so much for sharing that, Carly, because that's kind of a really personal take on it to share with everybody. And I'm aware that we're sort of coming towards the end of our allotted time. It's gone incredibly fast. I know we wanted to talk a little about the show, which happened a couple of weeks ago. So, Carly, you have quite a history with the Breast Cancer Now fashion show, which, for anyone that doesn't know, is sort of a fashion show for people that have been through breast cancer or are living with breast cancer at the moment. And it's a catwalk show, and it's very empowering for the people involved and for people to watch. And you have quite a long history with it, because your mum took part, I believe, and then you did, and then you came back this year to watch. And I just wondered how that felt, coming back as an observer to this amazing kind of process that you've been through yourself. Must have been quite emotional.
It is the most emotional event. I mean, you were there. There's not a dry eye.
Absolutely.
Anywhere. From the models, from the people watching in the audience. Watching was for me a kind of a much more emotional in real time experience, because when you're modeling, there's a lot of costume changes and you're like, okay, so every time you kind of feel yourself getting a bit emotional on the catwalk. Yes, at the end, the music, that was, and seeing friends and family in the audience, oh my goodness, that is a moment I will never ever forget. But I think there's something very powerful about sitting in a seat and watching all these models coming out and really seeing each face and seeing the confidence and knowing myself, just knowing how much every single person has come through, and knowing that my mum had done that just 2 months before she died. It was her swan song, taking part in that catwalk. And my mum had been a model, so for her to be back on that catwalk when she was feeling, pretty terrible. I remember dropping her off. It used to be at the Grosvenor Hotel. It was a big 3-course dinner event. It's changed now to, the concept of the event has changed from back then in 2009. But I do remember dropping her off and having a word with someone that worked at the charity and just saying, please watch my mum. Like, she was so weak and fragile when I dropped her off. I don't know who was on the catwalk that evening, but it was a confident, energized, she just loved it. And that is how so many people saw her for the last time, because she went into hospital quite soon after that. And I just think, how special is that for a model to be on that catwalk, kind of owning it? So for me to do it was always up there. Once I got diagnosed, I was like, I'd been back to cheer on people in 2019 as well, just before my own diagnosis.
Oh, fantastic.
Yeah.
Wow.
So last week's event was my 5th show I've been at. And it's always just the best. And if anyone is thinking of applying, oh my goodness, apply.
Would you encourage people to do it if they were thinking about it?
Encourage, I would say, it is so special. The whole experience, meeting the fellow models, getting pampered, hair and makeup, and wearing clothes, there's nothing like it. And you feel so, like you said, it's just a very powerful event. You feel it really helps with your confidence after something that can really strip you of it.
Yeah, that's amazing. We have had just one question in from June, who has noticed that she has a raised lymph node on her left side and was asking if she should contact her breast team. June, we would always say any symptoms, anything new that you've noticed and you're worried about, definitely do give your breast team if you're already having treatment, or if not, you can contact your GP. But we would always say, yes, definitely give somebody a call just to run it past them, to be on the safe side. And, things like this are around sort of raising awareness to help people feel empowered to do that. So, Carly, I would like to thank you so much for joining us tonight. We've kind of whizzed through so much, and there's so much more that we could have spoken about. Do you have any sort of final key points or words that you'd like to say to everybody? Anything that you felt sort of was particularly helpful for you that you'd like to highlight for people?
What shall I say? I think I can only speak from obviously going through treatment for primary breast cancer. And I just would say I remember feeling like I will never, ever have a day where I don't think about this, what it's done to me, how different I feel, the grief of it all, worrying about recurrence. And I just think, just one day at a time, I am not that person anymore. I have come so far. It's not something that is living, enjoying myself, having things like this. I've got that distance, and it does take time. But so just to give anyone that maybe is feeling like that, like how, just that hope that you can get there too. And I did have therapy. I would say if you are struggling, definitely support is there. It's really hard after treatment finishes. So just to be kind to yourself, reach out for support if you are struggling. But there is so much, life to be lived and enjoyed. And
amazing.
Just say that.
That is a fantastic sort of final message for people watching. And absolutely, as Carly has said, there is support out there for anybody who may feel like they're struggling. So again, you can always give us a call on our helpline, or reach out to your breast care nurses, GPs, lots of different avenues that you can reach out for support. So if you are struggling, don't feel that you need to struggle alone. There's always somebody that you can talk to. So just to finish tonight, just to thank you again, Carly, for joining us, and thank everybody for watching.
Thanks.
Thanks,
Bye.
Carly. Bye-bye.